Welcome to Pharma. Today we will discuss Naproxen. Before starting this video, I want to say that previously I have made videos on general anesthetic, local anesthetic and other unsaid drugs. You can check out my video by watching the playlist. So let's begin our today's lecture. My name is Dr. Muhammad Al-Hamilaj and these are my contact details. Generic name Naproxen, chemical name 2,6,2,6-methoxynephrine 2 propionic acid. This is the chemical structure of Naproxen. At the place where this is OH is present, if at that point here, if that point sodium will be attached, then it will be Naproxen sodium, whereas if OH is there, then it will be only Naproxen. So molecular formula C14H14O3, molecular weight 230.26 gram per mole, drug category NSAIDs and propionic acid. Description: the Naproxen is classified as non-steroidal anti-inflammatory drug and was initially approved for the prescription use in 1976 and then over-the-counter use in 1994. In 1994, it can be effectively manage acute pain as well as pain related to rheumatic diseases and has a well-studied adverse effect profile. Given its overall tolerability and effectiveness, Naproxen can be considered the first line treatment for a variety of clinical situations requiring analgesia. Naproxen is available in both immediate and delayed release formulation, in combination with sumatriptan to treat migraine and in combination with esomeprazole to lower the risk of developing gastric ulcers. These are the dosage form and strengths of Naproxen. Pharmacology is the same previously discussed. It is a propionic acid derivative, non-steroidal anti-inflammatory drug having anti-inflammatory, antipyretic, analgesic property, inhibits the COX-1 and COX-2 pathway, decrease the formation of prostaglandin and thromboxanes, and this is how it works. Mechanism of action: inhibit the synthesis of prostaglandin in body tissue by inhibiting at least two cyclooxygenase isomers COX-1 and COX-2. Also may inhibit chemotaxis, alter lymphocyte activity, decrease pro-inflammatory cytokine activity and inhibit neutrophil aggregation. These effects may contribute in anti-inflammatory activity. So this is the mechanism of action. Absorption 95%, viability, onset of action 30 to 60 minutes, duration of action less than 12 hours, peak serum time and peak plasma concentration is, you can see that, okay, protein bonding more than 99%, metabolism, liver bioconjugation, metabolites 6-des methyl naproxen glucuronide conjugates, excretion 95% through urine and less than 3% through feces. Route of elimination: urine. Volume of distribution 0.16 liter per kg. Clearance 0.13 ml per minute per kg. Biological half-life 12 to 17 hours. Indication: pain, rheumatoid arthritis, osteoarthritis, alkalizing spondylitis, dysmenorrhea, gout, migraine and juvenile orthopedic arthritis. Service level: category secondary and tertiary hospital over-the-counter drug. Pain 500 mg per oral initially, then 250 mg per oral after 6 to 8 hours, or 500 mg after every 12 hours. Depending upon the need and dose, total dose should not exceed 1250 mg per day, and the subsequent daily dose should not exceed 1000 mg per day. Extended release 750 to 1 gram per oral per day, and the temporary increase in dose to 150 1500 mg per day if not tolerated well clinically indicated. In migraine, 750 mg per day maybe give additional 250 to 500 mg if necessary, not exceed 150 mg per 1250 mg per day. Rheumatoid arthritis, previously similar, 500 to 1 gram per day in divided dose of 12 hours and extended release 750 to 1 gram every day. Dysmenorrhea, 500 mg per oral and then 250 mg after 6 to 8 hours or 500 mg after 12 hours. Similar, it is repeated for long-acting formula, gout, 750 mg per oral, then followed by 250 mg after every 8 hours until attack subsides. In juvenile idiopathic arthritis, the child having age more than 2 years, 10 mg per kg per day, oral suspension per oral in 12 hours, not exceed 15 mg per kg per day. In pain, patient having cancer pain, then 5 to 7 mg per kg after 8 to 12 hours. The total dose should not exceed 1000 mg per day. If the patient age is more than 12 years, then 500 mg initial dose, then 250 mg after every 6 to 8 hours, or 1200 mg or 500 mg after every 12 hours. Administration, 250 mg is equal to 250 mg sodium naproxen is equal to 200 mg naproxen, 825 is equal to 750 mg of naproxen, 550 is equal to 500 and 275 is equal to 250 mg. Delayed release formulation is not required for acute pain, and take naproxen with 8 to 12 ounces of water. If patient has GFR or creatinine clearance less than 30 ml per minute, then the use is not recommended. Stable at room temperature, contraindication, aspirin allergy and coronary artery bypass graft. Relative contraindications are bleeding disorders, delay esophageal transit, hepatic diseases, peptic ulcer, renal impairment, stomatitis, late pregnancy. Precautions, use caution in congestive heart failure, hypertension, asthma, hepatic impairment, aspirin sensitive asthma, anaphylactic reactions with NSAIDs, platelet aggregation, not OTC use for children less than 12 years. So the lowest published toxicity dose is 214 mg per kg for 30 days. Toxicity sign jaundice, drowsiness, lethargic, epigastric pain, nausea, vomiting. Antidote symptoms will be typical, subside with appropriate supportive care. Pregnancy, it is category B in first 2 trimester and category D in third trimester. The use of naproxen should be by the knowledge of physician, which in case of lactating mother. So if the physician recommend the use of naproxen to the lactating mother, then the naproxen should be taken by the mother, otherwise not. Though it has found in milk of lactating mothers, the concentration equivalent to approximately 1% of normal concentration of naproxen concentration in plasma, and the development and health benefits of breastfeeding should be considered along with the mother clinical needs for the therapy and any potential adverse effect on breastfed infant from the therapy or from underlying maternal conditions. Interaction 385 interactions 70 major, 297 moderate, 18 minor, and examples of interactions are methotrexate, cyclosporine, and digoxin. Adverse effect: abdominal pain, heartburn, GI bleeding, GI ulcer, fluid retention, diarrhea, stomatitis. Brand name: SYNFLEX, Apranex, and Nexin. These are the reference from where I I get all this content. So if you like our video, kindly share it with your friends. I will be thankful to you.